Do you know someone who has extremely painful periods? That person might be having endometriosis. So, have you ever heard the word endometriosis and wondered what it actually means and why some women suffer so much from it? I mean, even March is the awareness month of endometriosis. So let's understand this properly. A condition called endometriosis happens when tissue similar to the lining inside the uterus or your womb grows outside the uterus. This tissue can grow on your ovaries, your fallopian tubes, the outer surface of the uterus, I mean outside of this triangle, the lining of the pelvis, sometimes even on the bladder or the bowel. Now, here's the important part. This tissue behaves just like the normal lining of the womb, right? Every month during a woman's menstrual cycle, it will thicken, break down, and bleed. Now, inside this triangle or inside the uterus or the womb, that blood leaves the body as a period. But outside the uterus, the blood is nowhere to go. There's no state of Virginia, right? So it stays trapped inside the pelvis or your body. The trapped blood causes what? Irritation, inflammation, swelling, scar tissue forming, between your organs there. And this is where the symptoms come from. Women with endometriosis may experience very painful periods, pelvic pain even when they are not on their period, pain during sex dyspareunia, heavy menstrual bleeding, difficulty getting pregnant, extreme fatigue during their menstrual cycle. Now, here's something many people don't know. The amount of pain does not always match how much endometriosis is present. Some women have severe pain with very small areas of the disease. Others may have larger areas with milder symptoms. That is one reason the condition is sometimes diagnosed late. Now, here's the important clinical point. Period pain that stops someone from going to school, going to work, or doing their normal activities is not to be considered as normal. Hear me, people. Pain that severe deserves medical attention. Doctors may suspect endometriosis when someone has severe menstrual pain, ongoing pelvic pain, meaning pain here, pain during sex or intercourse, trouble getting pregnant. So treatment depends on the symptoms and the person's plans for fertility. Options can include pain relieving medication, hormonal treatment to slow or stop your menstrual cycle, surgery to remove the endometriosis tissue when necessary, or even remove the womb. Do you understand? So according to the WHO, World Health Organization, they say that it almost affects around 10% of women of reproductive age, which means it is a common but often underdiagnosed disease. So the take-home message is severe period pain is not something women should simply tolerate or take lightly. If pelvic pain interferes with daily life, relationships, or fertility, it deserves proper medical evaluation, because recognizing endometriosis early can reduce suffering and help women get the care that they need. Happy Endometriosis Awareness Month, March 2026.